gonna jump in quick. I can go ahead and monitor some of those things, so you guys can just have to worry about answering the questions. You don't have to worry about kind of fielding those things coming in and watching for the hands. I first want to ask, I think coming from 100 Row Women as an organization as a whole, thank you, first of all, for, I mean, doing this work. So amazing, and caring about those people that are overlooked. I mean, these high school girls, there's so much that is just boiled down to, you know, oh, a teenager, oh, they're going through this, oh, it's a hard time in life. But it's, those things may be true, but these things are so serious. And then Anne, in your work with these older populations that are, their needs aren't being met because they're expected to just like work with this world that's changing so fast and are getting overlooked. And so just really want to thank you for your work in highlighting these areas that really need support. And with that, I know, Anne, you mentioned that you've got a webinar coming up on Monday, and if there's any further work you guys are doing, how can people support your work? How can we show up for you?
Boy, Leah, you got any good ideas there? Both being women here.
We could start with, if there's, and I have a question, is that webinar like accessible to the public, that we could provide a link if people want to attend, or will it be recorded and we could send out a link as well if people can't make it on Monday?
You know, it's actually being recorded on Monday.
Okay.
And I'm working with a lot of aging services who have focused only on support and service. And the Minnesota Board on Aging has put together a policy that really talks about combining a lot of aging agencies under one new agency on aging. And that's really the context. They wanted me really to talk a lot about the fact sheet and normal aging, because our policy, none of our policy and funding is on healthy aging, and that's always what my voice has been about. So they want to interview me and record this, and they want to distribute it broadly, I think, to a lot of agencies to get support. So it's something that's going to be recorded and edited. And honestly, this is a bold, from my experience working with aging agencies, my voice is bold and not in line with public policy. So I'm not really sure where it's going to go or if it's going to go anywhere. I might be too bold for them, might want to be taking more steps, but I'm impressed that they at least asked me to talk. And you know, even coming here today, I have to laugh, because as a leader, I always try to support tables and build leadership, and I tried not to be the spokesperson. And I know I sound like Marge from Fargo. Yeah, sure. And I have that northern Minnesota twang, and so I try not to be the spokesperson. And now here I am, Marge from Fargo, advocating for older people. So it's just kind of this or that. So I can sure let Katie know where if this webinar is going to take off and be distributed, and then she can work with you on if you're interested.
That would be awesome. Thank you.
Mm-hmm.
Leah, do you have any ideas for how people could further support your project or access any information that you've collected?
Yeah, not necessarily at this point. You know, I think we're in a really good place. We have a lot of that local support that's really needed at the moment. So I think just keeping in mind this group, the 100 Rural Women that I'm now familiar with, and I can definitely, you know, share that down the road. But at this point, we're in a good position locally within my community for having the support needed. Thank you, though.
Okay, I have got another question in here, and that is in applying for this project, what materials do people need to prepare? Is it an idea or is it a whole plan? And what are you kind of looking for in future applications?
Yeah, that's a great question. So like I said, in the interest form, we just asked just very basic, your contact information, as well as just a little bit of information about the rural Minnesota community where you live or work, and just some basic ideas that you might have about a potential health policy issue in your community that you might be interested in. And we asked about that again in the application as well. And I do want to note that your ideas might change even if we accept you into the program. Like you're allowed to change your mind on the particular issue. You are not like committed to this particular issue if something in the time between when you're accepted and when the program starts, if there's something else that happens in your community and you're like, oh, I want to focus in on this, I mean, you're more than welcome to change your mind about that particular health policy issue. But just having a general sense of things in your community that you view as a problem that needs to be addressed as it relates to health outcomes, and potential skill sets that you would like to develop as part of the program. And so I believe then in the full application, we do ask additionally for a letter of interest. So just giving you space to elaborate a little bit more why you're interested in Project Reach, what you hope to get out of it, a little bit more about your community and the health policy problem that you're potentially interested in focusing on, things like that. And we do ask for, in past, we've done letters of recommendation. We are changing that now to just asking for 2 or 3 references as well, just in case. So that's pretty much the extent of the materials needed for the application. I think we also ask for your resume as well. And I see in the chat here, there's a question about only 3 accepted per cohort. So that's a really great question, Shelley. And so it all depends as well on how many people apply to the program and how many people we feel like we can support with the mentorship piece, because especially for our learning partners, it is a volunteer opportunity for our faculty and staff members at the University of Minnesota to work as someone's learning partner, and it's a commitment for them for the year to be someone's learning partner. And so we want to make sure that we have enough learning partners who we feel like can adequately support each individual for the duration of the program. And so our aim is 3 to 5 participants for the cohort. So it all depends. So I know that's not a great answer, but we really want to be mindful and make sure that the people who are participating have a really positive experience and feel supported by their learning partners throughout the course of the program. In the past, I've also not been a learning partner. However, I'm also happy to meet with participants one-on-one throughout the program as well. I do have a background in community organizing around substance use prevention and mental health here in Rice County where I live. And so it's been a joy for me to be able to meet with folks one-on-one to share some of my experiences and skills that I've developed through that advocacy work and help impart that to our participants as well. So that's been really fun for me.
Good to know. Thank you so much, Katie, for that extra information for anybody that is looking to apply or look further into maybe diving into this project. I think we have time for one more question, and I see Lindsay has her hand raised. Lindsay, do you want to ask?
Yeah. What was the most surprising thing for them in creating your project and working through it?
I can go first. So I would say the first thing that comes to mind when you ask that question is, although I was, born and raised in this community and felt like I knew it quite well, just actually diving into the data and having those conversations with local groups, it was enlightening, like I said, just to learn how many good things were happening. And it was impressive. It was just that, the school would be doing this one thing, they'd have this initiative, and healthcare wasn't aware of it, or the county wasn't aware of it. And so they were duplicating efforts when together we can do so much more and make a larger impact. So I think surprising in a really good way, I guess, just in that I learned so much about good things that were happening. There just was a lack of collaboration. So.
Yeah, for me, I think it was just being legitimized as a voice. Our older people, the narrative on aging is so terrible that as soon as you retire, you fall into the abyss of nothingness. There's no expectations. And there's no good words for even describe us. I like retirees because everything else is has pictures of us being feeble and losing our minds. So I think baby boomers are going to come up with better words for this period of time. We shouldn't have an age where we become invisible at 65. And we have so many resources in our aging populations, and we're going to have way more old people than school age children. And I see Walls wanting to do this whole thing for children, and there's more older adults in our communities than children. And I want to take whatever he's got an acronym about children, and I want to say that about aging, that we have to engage this population that's no longer working, but maybe should want to get more jobs, or for me, volunteering. We want purpose. We want personal agency. We want to belong. Communities are our heart and soul of how we live, and we just have to rethink all this.
Thank you for sharing. Yeah, absolutely. And you guys have this perspective that the rest of us don't have. Teresa, I see Theora has her hand raised. Teresa, do you think we've got time for one more? Should we? Okay. Why don't you go ahead and ask your question?
Thank you. I'm just amazed at Ann and Leah, and I see a crossover. I work in northern Minnesota now, a volunteer in my health organization, and I'm an older woman, so I've gotten so many good ideas from Ann today. Ann, I look exactly like you. I don't have my makeup and my hair done today, but my hair is exactly the same. I have the same necklace. I share everything that you say. And I also teach confirmation classes, so I'm real into my teenage kids, and I was a high school administrator in California. So I kind of cross both worlds, and I love what you guys have said. We are having a webinar next week, or not next week, February 2nd. It's called The Power of Connection for hospital volunteers and volunteer coordinators from 4 states, Iowa, Minnesota, North Dakota, and Wisconsin. I'm on the planning committee. I'd love to see some of you on. It's free. February 2nd, I'll send the link to Katie. And if you guys would like to join, we'd love to have your insight, because it's different from some of the volunteers. We're trying to get more, after the pandemic, we're trying to get more people set up as in leadership roles, but people are still hesitant. Us older folks are hesitant to do that. So I will send that link to Katie, and I'd love to have Ann, if you're on there, or Lindsay, or anybody else on the call today. I'd love to have you join in with your thoughts that day. So thank you very much for this. This has been wonderful.
How do you say your name, Theora?
Theora
Yep,
Goodrich.
I put my email and my contact information in the chat, so just send me the announcement or how to register. I would love to do that.
Thank you very much.
Yep, and I want to meet you. A twin.
Yes, exactly. Thank you. I want to meet you in person.
Well, thank you so much for all of the questions, and to our presenters, and for sharing about this project. I'm so excited and I feel very inspired and excited to see what more comes out of it. Just a couple of things wrapping up. So again, thank you for joining us with 100 Rural Women. Our next stage of growth that we're kind of working on right now is our mentorship program, and we're starting in the civic sector. And we have a survey we're gauging people's interest in participating, and we can throw that in the chat. And other than that, other ways you can join us is tomorrow morning, Thursday mornings, 8:30 to 9. We have morning connections. It's just an open time for people to come and hang out and meet each other and talk about whatever. It's unstructured, so we'd love to see you there. And then other than that, we've got our book club that meets the second Wednesday of every month. And we've got spotlight profiles that you can check out that come out. This month it was Susan Joyce, who is an author and a retired Wall Street financial advisor, really incredible woman. And we've got some really cool people lined up for the next few months as well. We'll be starting our Ask a Leading Woman sessions back up again in next month. And other than that, just join our email list, and we are so excited that you're here, and hopefully this was really helpful for some of you. So yeah, thank you.
Thank you again so much for having us.
Yep, thank you.
Thank you.
Yeah, thanks.